Hello, my name is Charlotte Williams. I'll be the nurse practitioner student doing your assessment today. All right, I provide the patient privacy. I'm going to go ahead and do some hand hygiene. If you can, tell me your first and last name.
Derek Williams.
All right, do you know what today's date is?
August 2nd, 2026.
Okay, do you know what you're here for?
Checkup.
And how did you get here?
I drove.
Okay, right off the back, his skin looks intact and hydration looks appropriate. Nutritional status looks appropriate. His hygiene is good. He looks like an averagely healthy male from the get-go. His posture is erect. He is alert and oriented. Times 4, he answered my question. His speech is good, and his facial affect is normal, and his mood appears to be normal. Okay. His vital signs we already got was 98.5 orally for his temperature, 116 over 72 for his blood pressure, 69 for his pulse, his respirations were 16, and his O2 saturation was 99 on room air. He is 5'11 and weighs 200 pounds. Does that sound correct?
Yes, ma'am.
Okay, we're going to start by examining your head. If you will, look all the way up for me. Look all the way down. Turn your head towards one wall and towards the other side. And look forward. His face looks symmetrical. His head looks symmetrical. His skull is round like it should. Observation, his hair is distributed evenly up until this point. Now he does have some mild hair loss here at the crown and a receding hairline. We are looking for any nits, lesions, things like that. No lesions noted. While we're back here, go ahead and palpating the full of his skull. Don't notice any deformities, indentions, things like that. All as well. We're going to palpate your temporal pulse, and it is 2+ on both sides. If you look forward for me, we're going to look at his face. If you will, take your glasses off. We're going to start with some sensation. Close your eyes for me and let me know if you feel this on your head, your cheek, or your chin.
Head, chin, cheek, cheek, head, chin.
Wonderful. Okay, I'm looking at his eyebrows. They are set apart like they should. I don't notice any lesions or nodules. His eyes look normal. They are midline. Looking at his conjunctiva is good. His sclera is good. Okay, everything's distributed like it should. We're going to look at your visual acuity. Okay, so he already completed a Snellen chart. His visual acuity without his glasses is 20/40, but corrects to 20/20 with his glasses on. Okay. All right, so first thing I'm going to do is just shine this. Just look forward, okay? Just shining, making sure that the light appears in the pupil like it should. Is good. Nostrobismus noted. All right, we'll look at light reflex now. Just look forward. Pupil goes to 2 millimeters. Goes to 2 millimeters. Wonderful. If you will, look at the tip of this, and don't move your head, but just follow it in with your eyes, okay? All right, pupils are equal, round, and reactive to light and accommodation. Now we're going to check some visual confrontation. Okay, if you will, you can grab your glasses. Okay, you go close one. All right, tell me what number you see.
1, 2, 4, 1.
All right, other eye.
1, 2, 4, 5.
Wonderful. Okay, one more thing that we're going to do. I already had your glasses on, but I can see we're going to do this 6 visual gazes, okay? Okay, so just at the tip of the pen, keep your head still, just follow the tip of the pen with your eyes. All right, so cranial nerves 3, 4, and 6 are intact. Now we're going to check cranial nerves 7 and 12 at the same time. So if you will, scrunch your forehead. All right, clench your teeth. Clench a skirt in your jaw. That does 5 as well. Smile and stick your tongue out. Say, wiggle it around, and close your mouth, and puff up your cheeks. All are intact. Okay, wonderful. Now, if I had an ophthalmoscope, I would use it to look in his eyes, which his glasses wouldn't be on, but since we're not doing it, I'm going to do the opposite eye of the eye that I was looking at. Like I said, his glasses would not be on. We're looking for the optic disc, the retina, the alveolar macula, and everything is good, and the landmarks are there, and we would do it on both sides, opposite eye. Next, we're going to look at his ears. So we just check the external landmarks, palpate, everything is good. There's no drainage, there's no lumps or bumps. I'm going to go ahead and feel some lymph nodes over around his ears. While I'm feeling these lymph nodes, I'm going to do his submandibular and some cervical ones as well for time's sake, which is good. All right, we are going to do a whisper test now. So if you will cover one ear and tell me what you hear. 1, 2,
1, 2, 3.
all right, cover the ABC.
ABC.
Wonderful, great. All right, now I would use the otoscope to check his ear, the internal or external canal, okay? We're looking for the tympanic membranes, making sure there's no blockages. Tympanic membrane is intact. It's pearly gray. There's no erythema, drainage, and everything looks good, and we would do this on both ears, okay? Next, if I had a tuning fork, we would do the Riney's test and Weber's test. Riney is a hard word for me, I apologize. So first, the Riney's test. So you would check with your tuning fork, you would hit it. We'd go back here for bone conduction, see how long that he heard it. And then we'd come right here for air conduction. And we'd want to know which one he sounded longer and stronger. So air conduction is greater than bone conduction, so he should hear this one for a longer time on both sides. Next, you would do the Weber. You would hit it and put it here on the top of his head. You'd want to know if you can hear it equally on both sides, more on one side towards the other, which you cannot, okay? And just assume normal findings for that. Next, we're going to look at your nose. So if you'll just look forward for me. All right, it is in line, midline with his face. It's not deviated to either side. Close one of your nostrils and breathe in and out. Other side. All right, and his nose is patent and intact. We can breathe from both sides. We're going to check optic nerve. I'm so far. Olfactory nerve. First cranial nerve. Tell me what that smells like.
Banana.
Wonderful, good. Right now I'm going to look into the internal structures. Look up for me just a little bit. I'm going to pull up your nose. Okay. Nasal mucosa is pink and moist. Looks good. Now his septum is deviated to the left a little bit, but I don't notice any polyps or nodules or anything like that, which is good. Okay. Next we're going to look at your mouth. The mouth is in line with his face. It looks good. If you will open your mouth for me. Okay, dentition appears good. Buccal area is good. It's pink and moist. Right, if you'll lift your tongue up and put your tongue back down. Okay, now stick your tongue out. Okay, say ah. His uvula goes up. I can see his hard and soft palate. His soft palate does like it's supposed to, and so does his uvula, which is good. Dentition is good, and he has full range of motion in there. Say ah again for me. All right, tonsillar grading is 1+ on both sides. No swelling, exudate, or edema noted. Everything is good there. All right, we're going to move on to your neck and beard area because your beard is here. Hair is distributed evenly. I don't notice any bumps or lumps. We're going to look at your neck, so if you will, just kind of lean it up for me. All right, his trachea is midline. There's no deviations noted. I'm going to use my light and go ahead and look for any jugular vein pulsations or carotid pulsations on both sides. Look to the other side for me. Don't see any here, no jugular vein distension. Okay, you can look back normal for me. All right, I'm going to go ahead and listen to your carotid arteries. So first thing I'm going to do is palpate for your pulse, your carotid pulse. Good. And it's 2+ and good. Listen for that carotid bruit. No bruits notated, okay? All right, go back to your neck. I'm going to palpate. So we're just going to palpate your thyroid and area at rest. We already did the cervical lymph nodes while I did the lymph nodes at the front. All right, if you will just swallow for me. Okay, wonderful. Swallow for me again. Rises like it should. I'm just going to move this around. Like I said, the trachea is midline. Everything is intact there and good. All right, so next I'm going to go ahead and do your upper extremities before I move into your chest because it's just the easiest for me. Okay, if you will try to push up on my hands. Now this is cranial nerve 11. Looks good. Put your arms out. Rotate them for me. I'm feeling your shoulders. Good. Okay, and you can put your arms forward. Okay, put it out. Do them out like this. Up. And back down. So we're checking rotation at elbow. His wrist, you flex your hands around for me. Good, wonderful. No clubbing, no dated. Capillary refill instant. Skin trigger, good. His skin is warm. Hair is appropriate. No lesions noted. Some scarring noted, but nothing concerning there. Okay, if you will squeeze my hand. Good strength. Okay, push down against my hands. Okay, now try, like that. Now try to push up. Wonderful. Full range of motion and strength noted. Okay, now we're going to do your chest and your lungs. So if you will take your shirt off for me. Okay, first I'm just going to inspect, just inspecting with some light. I don't notice any pulsations of the abdomen, any pulsations of his chest, any like tugging sensations. Do notice mild pectus excavatum. There, it's all well. Hair is distributed evenly. Color is normal. I'm going to come back to the front of your chest. If you will, swing your legs around on the couch, but keep sitting up. All right, so just everything is midline. His spine looks midline. Lean forward for me. Going ahead and checking the cervical, thoracic, and lumbar spine. Everything feels normal. You can sit up again. Just feeling all right. If you will, say 99 for me.
99.
All right, 99.
99.
And 99.
99.
All right, tactile for me is good. Okay, if you will take a deep breath for me and out. Expansion is good. Now we did notice there is no the anterior posterior diameter to the lateral diameter. We did check that. There's no barreling of his chest, and it is good there. Okay. While I am back here and I'm palpating and doing all of the things, I am also going to do the CVA area, the costovertebral angle, to take some time. So I already palpated all this. No lesions, lumps, bumps noted. No pain back here to this as well. So we're going to do some percussion. We're wanting resonance. Alright, all is well there. I'm going to go ahead and palpate that CBA area as well, which is good. Now we're going to listen, so you can kind of sit back up straight. Alright, take a deep breath. And out. Good. Again. Again. Good. Again. Again. Good. Again. Get that lateral side again. One more time. There and here. Good. All right, now if you will say E for me.
E, 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 E.
Agophony. It's good. It sounded like it was supposed to sound. Okay. All right, you can spin back around to the front. We're going to listen, palpate, and feel all of this. So here. So first we're going to palpate around just your chest wall. Precordium is good. Down here. We're going to the point of maximal impulse down here, which is that midclavicular line, and the fifth intercostal space is where it should be. Always like to palpate and feel the same. Precordium, all is well, and there's no revision. Already notated that in our earlier findings of inspection, which is good. Okay, so now we were just going to listen. We already felt his carotid artery ended for bruise, so now we're just going to listen for heart sounds. Now, when I did listen to his lung sounds, because we will do lung sounds up here as well, they were clear. There was no wheezing, rhonchi, crackles, no advantageous lung sounds noted. So now we're going to auscultate here, okay? So the first one we're doing is your aortic valve. Hold on it. And an Erb's point. Tricuspid. And that's your mitral. Okay. We're going to flip this around and use the bell and listen for any murmurs. I like to go ahead and do the bell in all the same areas. Okay. There were no murmurs noted. S1 and S2 sounded like they supposed to. It splitted like it was supposed to. The rate and rhythm was regular. No advantageous heart sounds, no rubbing. There was no S3 or S4 sounds noted. Now I am going to listen to his lungs again here in the front. All right, just take a deep breath. Again. I'm doing it fast. Wonderful, and no advantageous lung sounds noted there either. Okay. All right. Now, while I'm here, I'm going to feel your brachial pulse. 2+ in normal, and the radial pulse. Make sure there's no bounding. It's 2+ in normal, and rate and rhythm is normal for both. All right. If you'll lay down for me, we are going to do your abdominal assessment now. So we're just looking, I know we looked earlier for any pulsations. We didn't see any edema, didn't see any kind of ascites or third spacing noted. I don't notice any splenomegalia, nothing looks swollen or abnormal. So the first thing I'm going to do is just listen. Okay. So we're going to listen normally at the 4 quadrants. His bowel sounds are normal, active ×4. You'll listen at the aortic artery with the bell, making sure there's no bruise. I'll listen to renal, iliac, and then we would do femoral, which would be down here. But I'm not going to go that far. We would also, while we were all the way down here, we would do the femoral pulse, which is down here in the groin, but we're not doing that for this video. I'm going to listen at your spleen for any rubs or hums or anything like that, and the same at your liver. Okay. I didn't hear any advantageous sounds, so now what we're going to do is we will palpate, percuss and then palpate. So we're going to percuss in the 9 areas. We expect Tiffany, now we do expect some dullness here over the liver, and we just make sure it goes down, especially back to Tiffany. And all is well there. I didn't notice anything dull except for where it was supposed to be. No extra sounds, anything like that. So now we're going to palpate. So we just start with a light palpation in the 4 quadrants. Do you have any pain, discomfort there?
No.
Now we'll do a deeper palpation. Make sure there's none. Well, I'm over here at McBurney's point. Does it hurt when I push down here? What about when I release? No, cool. All right, any pain here?
No.
Now we're going to do Rosling's sign to check over here since we're deep palpating. So we just push really hard on this left side. All right, do you have any pain over there on that?
No.
Okay. All right, now we're going to check your spleen and your liver with this deep palpation. Take a deep breath and blow it out. Any pain at all there?
No.
All right, deep breath and blow it out. Alright, now swing Maglia noted. Alright, if you will take a deep breath and blow. Murphy's spine is negative as well. While we're here, we'll do psoas side. So leave your leg straight. I'm gonna pick up your knee. Now I'm gonna put my hand here on this right knee, push up against it. Okay, do you have any pain in this side? Alright, if you will flip over to your left side, we're gonna do this arbitrator sign. So I'm going to flex your knee. Okay, and we're going to do some inward flexion. Alright, do you have any pain in your abdomen? While I'm in here doing this, I'm gonna go also rotate, go up and back down. Okay. Flip to the other side. We'll go ahead and do that while I got you down here. All right, flex your knee, extend your knee, flex your knee, inward rotation, outward rotation of your hips, and all is well. Okay, you can sit back up and put your shirt on for me. So for his abdominal assessment was nothing concerning no ascites, no edema, no pain. Okay, now I'm going to look at his lower extremities. So the hair is distributed as it should be. Now I do notice some bruising. Do you know how you got those bruises?
At work.
Okay. Now they blanched like they should. There is no edema, no swelling. There's no clubbing of his toes. Capillary refill was within 2 seconds. Skin turgor, elasticity is good. I'm going to feel his popliteal pulses with the posterior tibial and the dorsal tibials, which all is good there. And they're 2+. I don't notice anything there. I don't notice any kind of arterial insufficiency. Seems to have good blood flow. While we're here, we're going to do the movements of your leg. So if you can, extend your leg out and put it back down. Do the other one and down. Now with this foot, kind of rotate it. Rotate it. Now over to the other one. Okay, if you will, push up against my hand. Okay, and push down against it. Wonderful. Up and down. And same with your knee. Push up and up. Okay. All is good there. Go ahead and feel the strength of your hands. Into your hands. All right, that is good. Before I get you to stand up and do anything else, I'm going to go ahead and do this neuro section again. So we're going to do sensation. I would like you to close your eyes for me. Let me know if it feels dull or sharp and where you feel it.
Right arm sharp. Left arm dull. Right hand dull. Left hand sharp. Right leg sharp. Left leg dull. Left foot sharp. Right foot dull.
Okay, wonderful. All right, now if you will, I'm gonna have you touch. You'll touch your nose and then my finger. Good, nose and finger, and that's good. Okay, and do your hand. Cerebellar function is intact. Moving it, it's like all done. Okay. Next, if you will stand up for me. Okay, if you will bend over, touch your toes, looking at his spine is symmetrical. He is good here. You can stand back up, turn your side. Yep, wonderful. And to the other side. Good, good flexion there. Right, if you will squat down and stand back up. Good. Now we're gonna check your gait, so just walk forward for me. All right, you can stop, turn around, walk to me on your toes, and now on your heels that way. Good. Now you can come back and stand straight. I'm gonna do that. You stand straight. We're gonna do one more time. Put your feet together, okay, and close your eyes. Just making sure there's no swaying. And we do this for about 20 seconds, but for time's sake, we're gonna say we're good and it's negative, and you have good gait and you can walk. All right, if you will have another seat for me, we're going to check your reflexes. So the first one we're going to check is your tricep. I need you to relax your hand for me completely. Now I do not have a reflex hammer, so I will be using the end of my stethoscope. Make sure it's loose, okay? Good. Relax. Good. Okay. Now put your arms outward, do your brachial. You can kind of relax it down. Good. And brachial over here. Okay. And we'll do this brachial, radial. Good. And over on the same side. Okay. Yes, you'll have to kind of up your legs a little bit so you can fully relax. So we can do this patellar. So kind of relax. We're going to. Good. The other side. And relax. Good. And hit that one as hard because you almost got me that one. Next we would do your Achilles. Be back there and back there, which is all as well. Okay. So I'm just doing things real quick. Strength, I think I already did that, but just double checking. He has full range of motion. All of his deep tendon reflexes, 2+ equal to both sides. He's a pretty healthy male. No real concerning findings. Now we do have some abnormal findings of his hair on his crown, the receding hairline, a deviated septum to the left of his nose. Does have that pectus excavatum and some bruising, but otherwise nothing remarkable was found in his exam. Everything is within normal limits. His skin is appropriate for his ethnicity, and he looks pretty healthy. Right, you have any questions?
No, that's it.
Wonderful.